encourage hydrotherapy. We have a lot of accessories to help moms, such as the yoga ball or the birth ball. A lot of moms bring a doula with them. We have numerous nurses that are willing, and able to do one-on-one supportive care for those moms that do want the natural birth and need coaching and all the good things that help moms get through it.
We do everything we can do to support them in that manner. We may do some back rubs, we may teach dad how to do back rubs, we'll frequent position changes, getting out of the bed, sitting in a chair, standing at the bedside, squatting, whatever we can do to help that mom be more comfortable and make it through her labor without an epidural.
Well, an epidural is probably the best method of delivery for pain relief medicine for laboring women because it delivers a small amount of medicine into the epidural space. This medicine doesn't really reach your blood system, but it has a great effect on nerves.
We have a good number of moms that come in wanting the epidural, and so once they start getting into labor, we will usually, each physician caring for those patients usually has a different time in which they allow them to have the epidural, because you don't want to put the epidural in when they're not in labor. So once they reach labor, usually they can go ahead and get that epidural, and that could be 2 centimeters, it could be 5 centimeters, it could be 8 centimeters. Typically anesthesia will come on down and get the epidural in, get them comfortable, make sure they're getting some pain relief, and then that remains in place till they deliver.
I think there are definitely pros to getting an epidural. Obviously, it doesn't hurt. My epidural was great, and I remember I was in so much pain, and then when I got the epidural, I actually started crying because I didn't feel it anymore. When you do get medication, you feel kind of out of it, especially afterwards, and it was kind of hard for me to concentrate when the nurses were telling me, what I need to do once my baby was born.
When patients come into labor, they typically have their mind made up as to whether they're going to want an epidural or not. Although along the way, sometimes they change their mind, and that's okay. Some of them will opt for IV pain medications in place of the epidural, and so we can also do that. And we just work with them through the process of not having the epidural.
What we do for a spinal is very much like an epidural, with one caveat that it's a one-time procedure, and we also add pain medicine to most spinals so that you have a better experience post-operatively, and you're able to get up out of bed a little better without that pain level being on the level of a 10. It's probably a 4 or a 5 out of 10. And that pain medicine lasts for about 12 to 18 hours.
I was in labor for a very long time and ended up having to have a C-section. But through the entire process, the nurses and the doctors, everybody made sure that I was as comfortable as I could be.
So I actually felt like when I was pushing and when Elizabeth was coming out, I actually really was experiencing it. Like I could pay attention to what was happening because I wasn't in so much pain.